24 січня, продовжую роботу.
Today we have the 24th of January. Ukrinform is on air. My name is Oksana Nechiparenko, and today we discuss the disease X. Is there a new pandemic coming, and how is Ukraine preparing for potential threats? And we're happy to welcome our guests, Minister of Healthcare, Mr. Lyashko, and Jarno Habikht, team leader.
So we have a lot of myths about X disease. So please explain us what is the X disease? Is it really dangerous? And can you really talk about the treat of a new pandemic?
Thank you. And for those I have not met this year, so I wish you a good continuous 2024 and a lot of strength and resilience. Now, the first topic we wanted to address together with Viktor Lyashko is about the disease X that has created a lot of news here in Ukraine, but also across the whole world in the past weeks, especially around the meeting in Davos. And let me define the disease X for you and for us. Disease X is a hypothetical disease. And we added in 2018 that disease to the list of diseases as a hypothetical disease that has potential for pandemics. And we are talking about that because we are just getting out of pandemics. If you are thinking where you were a year ago, 2 years ago, how Kiev looked like 3 years ago, where we had to limit our movements, we had to use the masks, we had to get vaccinated, and we went through the COVID pandemics, then actually all of us have experience of pandemics. And the disease X is a hypothetical disease to look for the new diseases that have actually potential for pandemics. 2024 is a critical year for the global health community and for the global health, because we are to agree the pandemic accord, and we are to talk about international health regulations and public health. We are talking about solidarity in 2024 for how we are getting ready for the next pandemics. And that's why the disease X is something that helps us to get ready for the future. So it is a hypothetical disease that WHO has added to the long list of diseases that have pandemic potential. We have around 150 different viruses that have that potential. And we don't know from where the next pandemic is coming. And we don't know that. I don't know that. Viktor doesn't know that. But what we know, that we can make our public health system stronger. And we are talking about the disease X, that we have better sequencing and surveillance, we have stronger laboratories, and I'm really appreciative for Ukraine health authorities that we are talking about that at the time of war, since 24th of February 2022 and Russian Federation full-scale invasion. So Ukraine is doing utmost at the time of war to improve also the public health community and the public health system. So let me say, it's a theoretical disease that is there in the list to get all of us ready. Because we don't know if this would happen after a few years, if this disease will be around us after 10 years, if it will be maybe at the end of the century, we don't know. But we know in the public health community, after seeing Ebola, after seeing Zika, after seeing COVID, that we need to be ready. And that is something what the public health community does. So if I compare it, it is getting ready for the winter. You buy wood to have fire at home. You have many areas of life where you get ready. And this is also what we do in public health. Let me link it for a second to COVID-19. In COVID-19, we learned that we need to have a good surveillance systems. Ukraine has invested a lot to the laboratories of public health across the whole country. And we together, as a WHO and the Ministry of Health, built strong public laboratory systems where many were tested. And that allowed us to control the disease, but that has one very important element. We can learn also about the new variants of COVID. And I like to say that in spite of the war and devastation around that, and more than 1,500 attacks verified by WHO, your public health system functions, and you are sequencing the new variants of COVID. And this helps you to get ready now and for the future. The second, we learned that hospitals need to be prepared. We worked a lot together on oxygen to ensure that it is there. And I think that has contributed a lot to the last 2 years of responding to war, that the hospital intensive cares units are better prepared. And finally, 24th of February 2022 is exactly 1 year of COVID vaccination since February 2021. And WHO, together with Hans Kluge, our regional director, just finalized the study on how many lives we have saved because of the COVID vaccination. And we know that in Ukraine, we have saved more than 14,000 lives because of the good vaccination program. And we need to continue that. So I just want to bring in the lessons that we have learned from COVID, surveillance systems, good healthcare system, ensuring vaccination, and that helps us to be ready for any of the other diseases. Let me stop and pause here, because I know the Minister Viktor Lyashko and the good friend has much more to say, and I'm happy to and ready to reflect also on other matters that is in your mind. Thank you.
Thank you. Отже, пане Вікторе, ми почули, що
Thank you so much, dear sir. You helped us to better understand how the world is preparing to a potential pandemic in the future. But what about Ukraine? Are we getting prepared? Have we learned those lessons of COVID? Well, first of all, let me wish all of you good health. And let me also wish that we do not have to survive another pandemics. So briefly speaking, there is no sensation. Disease X, pandemic 6 is nothing new. Jarno kept this silent, but there are too many fakes around it. There are so many false news distributed, including the territory of Ukraine, that is manifested in media monitoring performed by Ukrainian international experts, including professionals of the World Health Organization. But the reason why we are here today is to explain that pandemic X could be caused by a potential disease which can be spontaneously developing, but it might be following the footsteps of pandemic 2018, which was caused by COVID, but maybe something else, and we have to be prepared. But we learned the lessons. We could see how international health regulations performed, how legal norms performed, meaning both international law and domestic legislation as well. And thus we have to sit and sign a new pandemic treaty. And remembering the 77th Assembly of the World Health Organization, which will be happening at the end of May, there could be potential review and vote on the new pandemic treaty agreement, which will be clearly delineating the course of actions in case pandemic X occurs. But now, we are not only processing the documents, we are also actively preparing our systems, and not only health systems, to potential new pandemic, epidemic, or an outbreak of any basically infectious disease. Ukraine is not unique. Alternatively, we also learn those lessons, and we are making sure the system works. There are 3 key components to our preparedness. 1 is people, 2 is strong laboratory network, 3 is global partnership. Starting with the people. Within the recent 3 years, we have launched, reorganized the system of centers for disease prevention and control. Even during the martial law, the public health law was updated and endorsed, making sure that we have all the fundamentals for epidemic response available at the PHCs and at the central level, but also in the regional CDCs within the structures managed by the Ministry of Health. Also, we've increased the funding twofold In 2021, funding was disbursed in the total amount of 2.6 billion Ukrainian hryvnias. Today we have 4.9 billion hryvnias respectively to sustain our preparedness and response, which means that we are paying salaries for professionals in the system, and there's over 14,000 of them. But also we are improving our resources and assets, relying on the public resources, but also support coming from the international partners as in component 3 in our global partnership. And World Health Organization is one of our most reliable and resilient partners, I should say, which is also strengthening our epi-surveillance capacity. Just to mention that our reference laboratory is one of the strongest elements in the global network, making identification, making isolation, making sequencing, which means identifying RNA of the pathogens and then providing this information for the global network. Also, we are part of the CSER network, which is analyzing antimicrobial resistance, which is also one of the products in broad fields for our collaboration with WHO to exchange information to find new pathogens or identify pathogens in circulation with the potential capacity to cause pandemic X. And that is also one of the elements of our collaboration. Also, Ukraine, as a country, is providing financial support for building preparedness of healthcare facilities. In 2023, there were 193 healthcare facilities who signed a special package agreement under the title Preparedness and Response to Epidemic Infectious Disease Outbreaks. 2.8 billion hryvnias were disbursed for the benefit of this activity, providing for the trainings, providing for ICU equipment and refurbishment, for procurement of other types of equipment, but also making sure there are respective medicines kept on stock in each of those 193 facilities, which should provide for at least 3 months of daily operation, including situation of a pandemic event or an outbreak of any infectious disease, which would sustain functionality of such hospital up until the national or even global response mechanisms are triggered and deployed. Another important area of our collaboration with the World Health Organization would be cooperation with the EU counterparts. As you probably know, Ukraine is now part of the HERA framework, which was established in 2021 in European Union for the benefit of strengthening preparedness to respond to crisis situation. What is the nature of this cooperation with the EU? EU authorities have assessed what are the critical risks in the context of COVID, and that would be closing the borders, transportation restrictions. As the result, accessibility of drugs was under the question, because if you limit transportation, that means that raw products don't go to manufacturers and the drugs don't go to consumers. And now EU has conducted a mapping exercise to identify the locations of different manufacturers of both current member states but also candidate countries, and also mapping specifically what has to be done to be independent in terms of pharmaceutical production, both in terms of raw materials as well as distribution of the drugs, making sure that EU would be capable of producing that number of medicines and vaccines which would be necessary for the benefit of EU consumers and patients. We are also part of that system, and we are making sure that our pharma manufacturers, I mean the Ukrainians, will be also contributing to stockpiling, but also making sure that we can benefit from the stock accumulated in the EU countries. Last week, our Chief Sanitary Doctor took part in the Pan-European meeting, and we have officially committed to the global and European declaration for preparedness and response for potential pandemic X in case it does occur, to make sure that we can also contribute to resolution and benefit for the benefit of resolution. And that's what we do. We trained the professionals. which has received the respective support from the public programs. We improved our assets, and we also launched global partnership, which allows us to be fully prepared, including improvement of the local legislation to enable us to function and respond in a well-coordinated manner and help save health and lives of Ukrainian patients. Dear Viktor, we are talking about a hypothetical threat, but COVID is still out there. So what is happening with COVID in our country? Is there any probability of the same realities reoccurring when we have to boost our vaccines? A very good question. We continue epidemiological surveillance and monitoring for acute respiratory infections, including COVID-19 as well as influenza. So just to explain, what are we monitoring? Throughout the recent 3 years, we have very active influenza viruses circulation. Coming back to 2019, 2021, similar circulation was rather sporadic, I would say. There were occasional cases. But today, particularly after the new year, the number of viruses, type A and type B, is substantially greater as compared to the same period previous years. Moreover, influenza is competing with COVID-2019. But situation is under control. We are below epidemiological threshold, and we are monitoring situation both locally and nationally. And remembering that we are talking about infectious diseases, we have to pay a lot in terms of monitoring and forecasting. As soon as we can see that the dynamic is changing and alarming, then definitely we will be deploying additional tools to manage the situation. Let me stop here. Excellent. Let me also invite the mass media representatives to our interactive communication. Good afternoon, Antonina, Novini Live. Well, I have to admit I understood everything that you've explained, and it's very nice to appreciate that we are getting well prepared, because we won't have the same avalanche of COVID-19 falling on top of our heads while we are being unprepared. But there is another twist to the situation. We have the war, and we have a lot of servicemen, the combatants, who might not be well protected. And there is an idea suggested that namely the military, the defense sector should be well protected to make sure that we can protect our soldiers from the disease X or from another disease, because otherwise they won't be able to protect us. But the concern is that there will be shortage of supply, shortage of production, and should the pandemic start, who would be the priority category to protect? Civilians versus military. What would be the position of WHO? What is the position of the ministry? And what would be the action plan? Thank you for this question. We do understand as an ultimate priority that there is global partnership on the one hand and terrorist countries on the other. One of such terrorist countries is our neighbor, unfortunately. But we have to abide by the rules. One of the fundamental rules which is violated in Ukraine is the shelling and damage done to healthcare infrastructure. There are lots of reports suggesting that namely healthcare facilities are targets for the Russian Federation. Today, we have another report coming from Zaporizhia Oblast, while Geneva Convention clearly suggests that any building, any asset, any vehicle with a red cross on top of it should be protected, should not be marked as a target. This is a rule. This is the rule protected and cherished in Ukraine and globally, including in the UN structures and protection regulations. But there are different situations. And definitely, this will be something to be elaborated additionally. Tomorrow we'll be describing some of our preparedness plans in case of blackout, in case of another emergency, and we will have clear regulations and provisions for providing heat, electricity, medicines, other kinds of health service to any kind of a patient, including servicemen as well as civilian citizens of the country and everybody who needs such support. We have very clear coordination and support with the Ministry of Defense and other national and international actors. But most importantly, we clearly understand what are their security priorities. Some of them cannot be disclosed. Thank you. Irina Markevich, 1+1. My first question will be to Dr. Lyashko. Could you explain, please, are you monitoring the situation with the Omicron strain, which is called Jenny at the moment? Are there growing numbers? Or in other words, is the number of cases greater than 9, which was reported earlier? And second question to Mr. Jarno. I perfectly understand that the disease X is hypothetical, but why in different modeling exercises we are expecting that this disease might be 20 times more lethal as compared to COVID? Doesn't this give rise to new fakes, myths, and misconceptions? And couldn't that result in the new realities when the myths will prevail? And respectively, nobody in the world will be treating this threat in a serious manner. Okay, thank you for this question. As part of our epidemiological monitoring, we are monitoring different variants of strains which are circulating within our country, including situational monitoring, diagnostics, treatment, and also monitoring for circulation of different strains and different viruses for the benefit of modeling exercise and simulations. We don't have to do sequencing of each and every case in order to understand how different strains circulate, because that's where monitoring is about. It provides us with important decision-making data. And looking at the results of Ukrainian monitoring as well as global monitoring, the Gina strain does not result in any excessive complications. It does not require excessive use of oxygen. In other words, it's not more aggressive when compared to other strains that we are familiar with. That's why we are doing some randomized selection and in order to see whether or not it's still circulating and what would be percentage within the total pool of COVID samples. So at the moment it does not require any special solutions. It's not as aggressive as Omicron 2021, when oxygen therapy grew by 6 to 12 times in different settings, when we had to install new oxygen supply stations to perform new standards of care about using oxygen in our therapy, and also considering patient transportation and evacuation. So once again, we monitor the circulation, but we don't see any excessive burden, neither in the general care nor in the intensive care units. That is where and why we continue with our routine monitoring. Speaking of vaccine protection, on whether or not immunization helps against this strain, the answer is yes. We have the evidence clearly suggesting that people immunized against 2019 in earlier years can easily tolerate even the new strains, including the Gini strain, which once again suggests that the routine immunization is helpful and efficient.
First of all, I'd like to thank all the journalists in Ukraine and everybody also in the room, because after the Davos meeting and before the Davos meeting, Ukraine is one of the countries that actually pays more attention to the disease X than majority of the countries. So I really like to thank you for the attention, and I also understand the concern, because what I see from questions is we have seen more than 1,500 attacks on health, at least as WHO we have verified. We see the disruption in the system. We constantly have missile and drone attacks. Many of us have been spending half of the day today in the shelter. And it is not only in the front line where we were together with the minister in Liman and other cities in December, but also it's in Kiev and Lviv and Vinnytsia and the Western Oblast. And in spite of all of that, you are most active in global public health dialogue. So I'd like to thank you all that you pay attention to that, and that shows the resilience of the journalist and everybody around that you pay attention. Now, when we have modeled different diseases, nobody knows exactly, because we don't know about all the pathogens. I think you have asked questions also about the different types of COVID we have had. They were different in spread, they were different in lethality, and they changed over the time. And that's why we see now also new strains now. So I would take the 20 as an indicative number. It could be bigger, it could be smaller, it could spread more, it could spread less. But most important for us, and as a group, as a public health expert, as leaders, as journalists, is to pay attention to this, and then to look how we can inform also public what to do. And I think as we are going through the winter now in 2024, let's think also what measures we have to tackle the diseases we have now in the hand. We have COVID-19, we have elderly people, they have a chance to get COVID vaccination. And actually, we can save many lives. We have already saved more than 14,000 lives in the first year of COVID vaccination. We have saved many more at the time of war. And we can save many of our grandparents also in 2024. But also, I like to bring into attention of the importance of vaccination that also Viktor and many colleagues are highlighting. We need to much more pay attention that we are getting vaccination for measles, which is equally high level of threat globally. And there are many other vaccine-preventable diseases. So I love the resilience of Ukraine. And if every Ukrainian gets also all of the vaccination calendar done, I know that you are even more resilient. So I really like to turn the disease X to some very practical examples all of us in Ukraine can do, is to get our regular vaccination done, to control of our diseases, and to support our close ones. Thank you.
Thank you. Чи є ще запитання?
Excellent. Are there any further questions? Artem Sklerenko, Ukrinform. I have the following question. Is there any action plan, maybe something being put in practice, in case the disease X actually occurs, that it would be diagnosed at the right time and the treatment will be provided, including the frontline neighborhood, the occupied territories, particularly those areas which have been devastated?
The global perspective, and then Viktor can take it more to Ukraine. At the global level, when we monitor different pathogens, that is exactly the network that WHO, the scientists, the researchers have across the whole world. And it starts also with, in 2022, 2 years ago, we gathered more of 300 scientists, researchers, doctors together to ensure that we have mechanisms in place. And they are meeting regularly to give advice to Dr. Tedros and the global community what to monitor and what to do. So we depend that on those frontline villages from different cities across the world, the information comes to WHO. And then we have the best minds in the world to look what needs to be done. What happens very often, then we need to find out what to do. I think all of us here still remember the March of 2022 when COVID started, and I'm using COVID just as an example. We got first signals before. I think it was around 10, 11th of March when we had the first cases coming to Ukraine. And then a number of steps were taken. Everybody was beginning thinking how to do the testing. But very quickly, in few weeks, the tests were developed because there was a global solidarity and research and scientists who figured it out. And then they were distributed. And I remember these first days when the first were distributed also to Ukraine, we started to understand, is it more in the Western oblasts? Is it more in Chernivtsi? Is it more in Kiev? Is it more in Lviv? And these first tests allowed us to do the diagnostics. If there would be something new disease, whatever we call it, similar would happen. We need to collect the evidence information, we need to develop the tests, and at the same time we need to develop the treatment guidelines and to ensure that the treatment is there. So I just start from the global level, and because of that we have international health regulation. International health regulation is a global regulation that brings together 192 countries to share information, to find solutions, and it looks also especially to the diseases that grows across the countries and continents. So this regulation is there. And we discuss in 2024 about the disease X, because also at the global level, all of our member states, including Ukraine, and Ukraine is one of the leaders being also in WHO governing bodies, need to come together and agree how we go further. So this is at the global level, and I think we are today more prepared than to COVID, but I think we need to be always well better prepared. So I think as a human beings, we always can do more. But I assume and I know that Ukraine builds on the COVID experience because you have sequencing capacity, you have laboratory capacity, you have wonderful doctors and nurses. In spite of the war, they continue to provide services, and you have a public health knowledge. So I'm very hopeful that actually the capacities are there to be in the global network and bring then that knowledge as quickly as possible also to Ukraine. So being here more than 5 years, going together with you through COVID, I know that Ukraine is very agile, and the public health people always are there to find solutions. Just to give you the bit of the global perspective from WHO.
Нема що доповнити. Ну, коротко, дивіться, питання в тому, що лабораторії в нас...
There's hardly anything I can suggest on top of that. We do have the system of laboratories. They have equipment. We have sequencing capacity. There is more equipment coming. We'll be discussing it soon enough. It is something like mass spectrometry, when you put a sample into the machine, even if it's unknown, but the machine is smart enough to utilize technology for the benefit of identifying clearly what there is. And then it will be interfaced with the global network, and you will understand what kind of pathogen is involved in that case. This equipment is coming, and we'll be presenting it soon. Moreover, we have specially equipped vehicles for transportation of samples. So it's not the matter of taking laboratory closer to the place where a sample was taken, but taking this closer to laboratory. We have USAID and WHO providing us with quite well-equipped PCR testing laboratories which are mobile, which means within a matter of hours we can start such laboratory operation in any location, even in those locations which didn't have any COVID testing in the stationary settings. So another question would be to find a medicine or vaccine. In case of COVID-19, it took more than 320 days from the virus to vaccine. Now, WHO standards expect such solution to be found within 100 days in case of pandemic evolving. And these are also global elements of our capacity build. Okay, any further questions? If not, then this is time to thank our speakers for explaining us clearly what disease is, should we be cautious about it, and our media center will continue operation tomorrow, and thank you for staying tuned.